Okay, well, we're going to go ahead and get started. Good morning. I'm Lillian Montoya, President and CEO. We have several members of the executive team and our executive COVID task force on our call today. As we do, we've been having these virtual town halls on a weekly basis so that you are up to speed on all of the things that we're getting to do together in caring for our community. So as always, you can ask questions through the Q&A on your Q&A icon on Zoom or through the chat. Preferably the Q&A, because then we can track them a little bit better, because the chat is very chatty. And then if you don't get a chance to ask questions during this town hall, just send an email to virtualtownhallquestions@stvin.org, and we'll go get those out, responded to. Every Friday, we post the recorded town hall, these slides, as well as all of the Q&A. So if your colleagues don't have a chance to watch this live, they can watch it from home later. They can, the evening, or just go right to the Venturenet when you have a break and check it out. So our agenda today is similar to each of these weekly updates, and it's one where we are going to have a poll here just a moment. We're going to have an inspiration from Kathy, and then our update about our response to Q&A, and then we'll have miscellaneous updates. The goal is to get out of here in about 40 minutes or so. So, Kathy, you want to get us started?
Good morning, everyone. In the spirit of Thanksgiving, I have a beautiful quote from William Arthur Ward this morning. Gratitude can transform common days into Thanksgivings, turn routine jobs into joy, and change ordinary opportunities into blessings. So for this Thanksgiving week, I wish you all lots of joy, lots of gratitude, and many, many blessings.
Thank you, Kathy. So let's do our little poll here. It's a good way to test our ability to use Zoom. And it's a very easy question this week. We all are planning for some sort of Thanksgiving celebration. And so our question today is, well, I might get my little mouse here going. How has COVID changed your Thanksgiving plans? Or has it? Yes, no, slightly altered, or going to order pizza? I know for me, it's just going to be me and my dad. My siblings are not flying in, which was wise, and other family members that live locally, we're all going to just Zoom in. So it's going to keep everyone safe through the season. At the end of the day, my responsibility is my dad, and so I'm going to do what I can to protect him. And I'm going to go ahead and wrap this up here in about, 10 seconds or so. Looks like over 60% of us have changed our plans. I'm going to end the polling here. So yes, slightly altered, ordering pizza. There's just a little handful of you, 9% that said no, which probably means I hope that you're going to keep it small. So here's the data. Okay, so let's go ahead and get started on our update today. And I'll turn it over to Dr. Ronan.
Thank you. You can go on to the next slide. Teresa Ronan, Medical Director of Quality. So I'm going to start off with some of our COVID-19 testing information. So yeah, as of yesterday afternoon, we have now tested over 15,000 individuals for COVID-19. Unfortunately, about 1,400 of them have been confirmed to have the virus. Yesterday afternoon, we had 226 individuals awaiting results. This is not a reflection of a slower turnaround time. This is a reflection of the sheer volume of patients that are coming through our respiratory collection site. These individuals should get their results back today through MyChart. We have now taken care of 284 separate admissions in our Frost 19. And as of yesterday afternoon, there were 22 patients being cared for. In Frost 19 this morning, there are 28. Unfortunately, we continue to see people die of COVID-19. It seems almost daily now for the last few days. We now have had, with today's information, now 33 individuals pass from COVID-19, and that gives our case fatality rate right around 2.2%. Next slide.
So these are the rate of spread is pretty comparable to what we're seeing in the state as a whole, because these just reflect St. Vincent, right?
Yep, that is correct. This is just St. Vincent's.
Oop. Well, I'm having operator error here. Okay, there we go.
So many of you are wondering about colleagues becoming sick with the virus. And we have now had 105 associates test positive for SARS-CoV-2. And I know that your first question is going to be, how are all of these folks doing? And fortunately, the vast majority of these individuals have recovered and returned to work. We still have 38 associates out on quarantine. You know, your next question is how are they catching COVID-19? And it turns out that the vast majority of our associates are not contracting COVID-19 at work. It is via community spread. So we have 2 confirmed occupational acquired infections back in March. We have 86 confirmed community acquired infections, and we still have 17 that are under review. And then another question that many of you ask is, which clinics are closed because of COVID-19 in that clinic? And right now, no clinics at Christus St. Vincent's are closed because healthcare workers have COVID-19.
And to be clear though, we have closed them for a day or half day to make sure that we're able to do contact tracing and get folks in there to clean the facility. But we do it so quickly that we're able to keep those clinics open for the most part.
And what we're seeing in our Christus St. Vincent's community about community spread versus healthcare acquired contraction of COVID-19 is what is being seen by large institutions across the country. So many of you may be aware that last week, Mayo Clinic of Rochester had 900 employees with COVID-19 in 2 weeks. 93% of those were not infected at work. And they put out a release that their staff was mostly infected with COVID-19 due to community spread, not work-related spread. Next. And there's a similar story at the Cleveland Clinic. This was published yesterday in Becker's Hospital Review, but 925 workers at the Cleveland Clinic in Ohio had COVID-19. And again, vast majority of these infections were through community spread, not occupational exposures. Next slide. And so I want to make 2 points. One, be a safe hero when at work, because the way people are contracting COVID-19 at work is frequently when taking off a mask and eating with each other. So this slide is I give credit to Monica Taylor. I think there's a lot of humor in this slide. How to tell when you are not sitting 6 feet apart in the cafeteria. You can touch your coworker's sandwich. Your coworker can touch your sandwich. The guy sitting with you can touch both of your sandwiches at the same time. You have to say, excuse me, to the guy next to you because he's sitting too close for you to get up and throw away the sandwich that the other guy who is sitting with you and your coworker just touched. And only 6 foot-long sandwiches will fit end to end between you and whoever is sitting next to you. So please be a hero when you're at work and socially distance yourself from the person dining with you. Next slide. And in the same vein, I think these are the Swiss cheese slices from that hero sandwich on the last slide. But this is my second point, is be safe when you're in the community so you do not bring the virus to work. So many of you might be aware of the Swiss cheese model of safety, and that each layer of cheese provides an additional layer of safety. So you have the SARS-CoV-2 virus on the right, and some of it can penetrate those cloth masks. But then you have a layer of protection if you are socially distanced. And another layer of protection if you clean and disinfect, and another if you do good hand washing. And in the end, this individual didn't get COVID-19 because of all of these different layers providing protection. Next slide. This is a look at what's happening in our Frost 19. This is the COVID unit over time, and I just want to show the graph on the right. You can see that per week in the summertime, we were hovering in the low teens for the number of individuals that we were caring for in Frost 19. And then in the fall, it declined to just a handful of patients per day. And then in the last several weeks, it has sharply risen to the last report. That particular day, we had 33 patients. Next slide. And this is a graph that I like to show because I really feel like it illustrates what we're feeling at the hospital over time. And the blue bars represent the number of tests done. These are PCR tests. The purple bars are the positive results. The gold are positive cases at outside hospitals. And the red line going across the graph is the cumulative case count. And as you can see, that cumulative case count has markedly risen over the last few weeks. Next slide. And this is my last slide for today. This is our percent positivity rate over time. I do want to point out that this percent positivity rate is a little bit different than what other places report out as a percent positivity rate, because our information is going to be skewed to a higher number because we are testing people that either have symptoms or significant exposures. We're not testing everybody in the community. So we're going to see a higher number. But over time, you can see that the majority of the time we've hovered around a 5% positivity rate. And then in the last several weeks, it has sharply risen. And, you know, as a visual, when you're driving past that respiratory collection site on Cerrillos Road, and if every car in that line has one patient in it, 1 out of every 4 cars is going to have someone that tests positive for COVID-19. So that's just like a visual on what we're seeing. And that's it. Oh, no, it's not it. Sorry.
Oh, you have 2 more.
I do. I forgot about that. And they're important. So we've been asked a lot about, can I get tested? So the first statement that I want to make is that if you are feeling sick and think you could have COVID-19, the test of choice is a PCR test. But if you are just kind of wondering, did I have COVID in the past? Maybe have I been exposed? We are offering all associates an antibody test. And the way you can get this done is by calling Employee Health and they can order it for you. I do want to speak to a couple things about antibody tests. So first, with the antibody test, there are 2 different types of antibody. There's an IgM and an IgG. An IgM is the early responder to the virus and can often signify an active infection or a very early recovery of infection. And the IgG is the late responder. This is your body's memory to having had an infection in the past. So if your IgM is positive, you must then get a PCR test for confirmation of the virus. So if you do call Employee Health and get this, and your IgM is positive, you have to get a follow-up PCR. The other important thing to note about an IgM antibody is that if you're very early in your infection, days 1 through 6, you might not have enough detectable antibody for your test to become positive yet. So if you really think that you could have COVID, this isn't a ticket that you're free from the disease and you can, you know, visit someone that's elderly without your mask on or whatever. So your behavior, what I'm trying to say is, regardless of the results, your behavior really should not change. The IgG component is a marker of potentially being infected and recovered from the virus. But again, there's a lot that we don't know about being immune from COVID-19. So again, if you only have an IgG that's positive, this is not a free ticket that, you know, you are immune and could walk around in the Frost 19 without your PPE on. It might, though, imply that you had it in the past and that there may be some layer of protection. So the bottom line from those slides is that regardless of what your results are, you still need to wear a mask, socially distance, and all of those other protective measures like hand hygiene, etc. And now my very last slide, and a very important slide. So we have heard from a number of people in the CSV community about needing some additional support. This pandemic has been hard on us all, not only working in healthcare, but the strains and stressors that it has put on our daily personal life, from childcare to getting groceries to visiting loved ones. And so as a result, Jack Conrad and Kathy Armijo-Itri are volunteering time on Monday early evenings to have listening sessions. In each one of these listening sessions is going to have a slightly different theme and a slightly different target audience. And I think this is just a beautiful way to have collegiality, camaraderie, and to provide support to one another. I attended the listening session yesterday afternoon, and I felt very good to know that some of the feelings that I had were also the same with my community, and it made me feel better.
It was well done. It was really, I know Dave was on there, I was on there. There's a good number of us, that Lance and others. It's good to sort of just check in and see how we each are doing through this pandemic. So thank you, Teresa. Before I go to Dr. Marks, your slides on reprocessing and N95s, et cetera, I thought we'd stop and take questions, but before even that, I wanted to start with Lance and see what he'd like to share with regard to the clinician group and activity there, and Dr. Park. I see Lance, but
Sure, yeah. I'm in my car. I'm out dressed up as a turkey visiting clinics today.
Well, we want to see this. What are you talking about?
Okay. All right, hold on. Let me put on the headpiece and turn on my video here briefly. All right, can you see me? So I'm in the Entrada Contenta parking lot right now, getting ready to go visit there. I've already been to Pewaukee.
That's the best. Tell people why.
Yeah, so I put a challenge out there. We did our first clinician engagement survey, like the Glint surveys that we're all used to doing recently, and I put a challenge out there that if we got 85% response rate, that I would dress up like a turkey and go deliver treats around Thanksgiving. Well, we got to 70%, and so I dressed up as a chicken, and I'm out delivering treats today. So as far as the clinician group, you know, it was already mentioned, we did have a couple of times when we closed a clinic here and there for a short period of time, generally one day, when we knew about an associate that was positive from contracting it in the community, and we wanted to check other folks. But right now, the rates of positive tests in associates has gone way down, and we're doing really, really well from a clinic standpoint. We are seeing no-shows, so patients are choosing sometimes to not show up for their visits, and so we've been shifting and doing a lot more video visits like we did in the spring. But people aren't getting care that they need probably right now because of fear, and so I think more and more that we can spread the message that we are safe, it's a safe environment. When I was at Pewaukee, we were talking about the positivity rates, and the numbers that we're seeing at work are lower than what's happening in the community. And so we really are doing a good job of keeping people safe with our masks and with our hand hygiene and all the activities that we're doing. So all in all, we're doing pretty well from a clinician group. I'll turn it over to Chris for her comments as well.
No, I agree. Like, I think just keeping everybody, up to date on what's happening, and I appreciate Teresa's daily reports. And I think that social distancing in the break rooms, that's probably the most important thing that we do here in the clinic, and just making sure that everybody has the equipment that they need, and patients feel safe when they come in. So really trying to push more video visits, but we can do a lot on video. So I'm confident that we can really, continue to manage our staff and our patient safety.
Great, thank you. Monica, I'm going to ask Monica to talk about PPE and activity in Frost, and Dr. Gonzalez to talk about just a brief update on what we're hearing in our statewide medical advisory task force conversation. So Monica.
Hi, everybody. Good morning. Monica Leba, Chief Nurse Executive here. Thank you for each one of you being on our huddle this morning. Wanted to give you an update on the PPE. We continue to source from anybody that we can so that we can continue to have plenty of PPE to keep you safe. The main types of PPE that we use to prevent the coronavirus or to treat patients that have the virus are your face shield, your mask, your gown and gloves, and we continue to receive plenty of that. As a matter of fact, this week we were able to source 200,000 medical masks, so we'll be putting that in our storage area so that we have that for you. In addition, James Marks is going to go over a few updates around the N95s. That is our most precious commodity. And reason being is that is the one resource that is hard for us to get. We don't get a large supply of them. So we continue to reprocess those that are required to wear them, and we'll continue to do that so that we make sure we have enough.
Okay, thank you. Dr. Gonzalez?
Yes, just a couple points. As Dr. Ronan said, our positivity rate was 26.9%. Just an FYI, then on the news last night, the state was reporting that their overall positivity rate, that means asymptomatic and symptomatic people coming to their sites across the state, was approaching that same number. So that attests to the significance of this infection throughout our state. The other thing from the state that I just wanted to mention is UNM Hospital has also reported several hundred positive cases amongst their employees, and to date only 9 have been shown to be occupational acquired. The rest have all been employee to employee, bringing it from the outside. So that just further stresses how important it is to social distance at work. And the modeling projection is going to come out today, and it doesn't look good. They're expecting, right now, as of yesterday, we had 825 COVID hospitalized patients throughout the state. 231 were in the ICU, and they project by December 9th that number of hospitalized patients will go from 825 to 1342, with 381 patients in the ICU statewide. So it's really important this week to really social distance and keep safe.
Thank you. Anyone else on the executive team or on our panel that would like to say anything before we go ahead and head to James' slides? Okay, we'll go ahead and start there. I'm sure it'll elicit more questions. So.
Well, good morning, everyone. I'm James Marks. I'm the Executive Director of Quality and Performance Improvement. I've been with Christus St. Vincent for about 2.5 years. As Monica said, we do have a limited number of N95 respirators, and we expanded the areas that we are going to offer N95 or actually have people wear N95s. So it's critical that we reprocess. You need to know that it's critical that you reprocess your N95 after you use it. So this is an instruction sheet that is going to be, or that is posted at all of the reprocessing centers, stations, which I'll show to you here in a moment. The areas where they are in the emergency room, Frost 19.
Oh, I'm sorry, I totally had operator error there, or stop sharing.
I can remember. Frost 19, the emergency department, digestive health, labor and delivery, and then in the operating room. So what's an important note is that your N95 respirator will be sterilized and returned back with your name on it. So you would be reusing your own N95. And it's critical that you label, it's 17 there, yep. It's critical that you label your N95 correctly and follow the instructions that are on there. The first time you do it, I suggest that someone has reviewed it with you, because if you don't have all the components, I think Lillian, we need to see the, yeah, there we go. We need to see the presentation, or sorry, we need to see the example there where it has your name on it and the unit that you are having it reprocessed. Again, this will be posted in each of those locations. They are picked up at 8 p.m. in the evening, and they're returned back to the reprocessing site in the drop-off area by 6:15 the next day. So if you drop it off after 8 p.m., it won't be reprocessed until the next day, 2 days later. Next slide.
So everyone is they're dropping off their own N95 and picking up their own N95. I think
That's
there were
correct.
some questions about that.
That's correct. So the first area is Frost 19. The drop-off area looks like this. You'll see the blue bin with the biohazard symbol on it, and the supplies that you need in order to write your name, put the indicator in, and then you put your N95 into the pouch, and then leave it in the reprocessing bin that's there. The pickup area is a cart that is alphabetized, and the goal is for all the areas to have a cart like this that's alphabetized, so it's easy to find your N95 respirator when you come back the next day. Next slide. In digestive health, this is the drop-off area. Again, a blue bin with a biohazard symbol on it, all the information that you need, or all the equipment you need, and the information sheet that's posted above it. And then the pickup area is behind the desk in again, a blue bin that's labeled for digestive health. Next. The operating room. This area is very limited badge access. So in order to get in there, you would have to have badge access, and you need to wear scrubs and hair covering in order to enter this area. So this is a very limited access area. The entrance is off of the main corridor going into the operating room. There is the drop-off room is labeled with the letter D, and you can see the biohazard symbol on the door. Plus it says N95 respirators to be sterilized to go in there. And then the pickup room is a little further down, the room that's labeled, or the door there that's labeled F. And inside there is a pickup shelf with paper bags with the N95 respirators. Again, the goal is to have a card in there that's alphabetized to make it a little bit easier to find. Next. In the emergency department, there is a room, again, that is labeled N95 mask to be sterilized. It's in room 2765, which is just above the threshold of the door there. And the entry code is 123 in order to get into that room. The pickup area is down by ED room number 7. It's a little ante room by ED 7. And right now there is a cabinet, or there's a chest of drawers there that is alphabetized. But again, the goal is to have a cart with the pickup so it's easier to find your mask. Next. Labor and delivery in the triage area. The drop-off area is right there in the beginning of the triage area with a biohazard blue bin with a biohazard with all the items you need to write on it. And then the pickup area is just to the right of that, currently using paper bags, but again, we'll be using a cart in the future. So everyone probably has heard that we are going to be expanding N95 use in certain areas of the hospital and in some of the clinics. So these are the areas. If you work in any of these areas and you've not been N95 fit tested, we are in the process of creating fit testing clinics for the staff so that they can get tested. This is a very large undertaking, and we should have more information next week. I want to emphasize that it is still safe to wear a mask, a regular medical mask, and eye protection while you're caring for patients in these areas. but we wanted to expand for an additional layer of protection for using N95. So stand by for more information next week. Probably at the town hall next week, we may have some more information about when we're going to be able to do these fit testing clinics. If your area or your associate that you're concerned and you want to have an evaluation, you can contact infection prevention to have an assessment of your area as well. So an exposure, a COVID-19 exposure reminder. This was presented last week. An exposure is less than 6 feet and more than 15 cumulative minutes in a 24-hour period when the COVID positive person and the exposed person are not wearing a mask, or if the COVID positive person is not wearing a mask and the exposed person is wearing a mask but not wearing eye protection. That is the very limited exposure definition. The other one is if there's an aerosolizing procedure being done and all of the PPE required for an aerosolizing procedure, including the N95, are not in use, that would be considered an exposure. So one of the questions in the chat box was, are we notifying patients if they're exposed to an associate who's positive? If they meet this definition, yes, we would notify a patient if they meet this exposure definition. However, because all patients are wearing masks and all staff are wearing masks, this would be a very, very unlikely exposure from a healthcare worker to a patient. And I think there was another question. Oh, a question about in the break room. You've heard on the television where people say open the windows. What they're talking about is when you're at your house where you don't have air circulation that's designed. We're in a healthcare facility that air exchanges in rooms have been designed to be probably around 6 air changes per hour, which is a good airflow. If you have concern about specific break rooms and airflow in those break rooms, we can contact facilities and do an evaluation to make sure there's adequate air exchanges in the room. Is there another question, Lillian?
I think Chris is answering one, but it's a question about, is there an approved reusable eye protection, is a list of approved reusable eye protection and reusable masks that employees could purchase from outside sources to wear into the hospital or clinic setting?
So masks, you need to use the hospital provided medical masks and N95s. You cannot bring in your own mask without approval from employee health. And the same thing with eye protection. We recommend that you use the hospital issue eye protection, but if you have your own, say you have prescription goggles, then you need to contact employee health so they can evaluate that it meets all the OSHA requirements.
There's a question about fit testing, and will we be making it available in the late evening for folks that work different hours?
So that's something that employee health and human resources will work on, is making sure that it's available for people who work all shifts, not just limited to the daytime weekday hours.
And then Dr. Gonzalez, there's a question about ICU beds, or Monica, how many are there in the state? And what are the projections saying about available ICU beds?
Mm-hmm. I believe the number of ICU beds is something like 540 to 560. And that's why that number that I gave you with ICU beds, and right now every one of our institutions with exception of the Southern hospitals have a slight ICU room capacity. But if we go up to 831 by December 9th, then we'll be in trouble.
Okay, so let's stop here for a minute and see if there are other questions. So I know we've had people that present with symptoms, and what we're finding in some cases it's allergies, or it's not really an exposure risk. But what happens, James or Dr. Gonzalez, if someone's not feeling well? Should they come to work?
So if you're not feeling well, please contact employee health to have them talk through your symptoms before you come into work, and then offer you testing if you meet the criteria with the symptoms. But we do not want you to come to work. If you have allergies and that's something that is occurring day after day, then again, you need to work with employee health, and they'll be able to help you decide if this is an allergy or if this is some change in the symptoms that you're having.
Yeah, so don't make a decision to call off and not come in independent of talking with employee health so they can ascertain whether or not you really are at risk. This is going to be a particularly difficult time, probably more so after Thanksgiving, when we start and expect to see an increased number of cases present in various parts of the organization. And so we really are going to need everybody and all hands on deck to help support the teams that are caring for our patients. And so if you feel like you are sick because of the virus, you need to call employee health. And if you're sick and you don't know why you think you might be sick, you need to call employee health and not just make a decision about calling off because you kind of don't feel well. We just want to make sure if indeed you truly are at risk so that we can take care of you, and also make sure that you're available to help us care for our community. It's just going to get a little bit more challenging as we go into these next few months. And I would guess, and Teresa and others, correct me if I'm wrong, if people do spend, if everything we're seeing on TV, where there are people getting on planes and people planning on doing gatherings at Thanksgiving, when would we start seeing that activity of exposure in the community? 7 days, 10 days, 5 days? What does that look like?
About 10 days later, we'll really see it.
Yeah. So, okay. Any other questions or thoughts that folks have that are on our panel that we want to share with the group?
I will say make sure that if you do call employee health and its phone rings and rings and rings, please be patient. They have quite a lot of calls, quite a lot of things that they're doing. If you leave a message, you will get a return call, but sometimes there can be a little bit of a delay. If you're concerned about coming to work, please contact your manager if you can't get a hold of employee health, just so that they have a heads up that you won't be able to come into work until you get cleared by employee health.
Hey, James, do prescription glasses qualify as eye protection?
They do not. They need to have, like my glasses wouldn't, because they need to have sight protection on them, as well as covering the top. So for me, I would have to wear either goggles over these glasses or a face shield.
What about wearing a cloth mask? Is it acceptable to wear one of the cloth masks we have over or under a medical mask if we're not in patient care areas?
So if you're not in a patient care area, you can wear a cloth mask. If you are doing any patient-facing activities, you can wear you need to wear a medical mask. If you want to wear a cloth mask over your medical mask, that's fine. It may be a little more restrictive on your breathing, but you do need to wear, again, the medical mask when you're having any patient-facing encounters.
Okay, and then there's a comment here that our employee health is recommending to test 5 days after possible exposure, but Department of Health is recommending 7 to 10. Do you want to speak to that discrepancy?
So the incubation period is 5 days is sort of actually they recommend 3 to 5 days for the early testing, but waiting 7 to 10 days can potentially cause more anxiety for you. So we've kind of come in the middle and made the decision based on the information that's available to do testing 5 days after exposure when we're doing exposure follow-up with PCR. If you are concerned and that you think you might have been exposed, but you don't meet this exposure definition and want to get antibody tested, then we recommend you get antibody tested 7 to 10 days after the possible exposure.
Okay, thank you. So with regard to financial hardships and challenges that you may be facing in your household, remember that the foundation has a fund set up that associates can apply to for short-term assistance in key areas. If you are interested and want to be and would like to do that, please reach out to the foundation. I don't know, Javier, if you want to offer anything there.
Yeah, no, please do. You can get, if you don't have our updated email addresses, you can get it right off the website. Touch base with me directly, and we'll make sure that we're able to provide the assistance that's needed.
Okay. I'm going to go ahead to this miscellaneous update slide. I'm not sure if folks have much more to share. I thought it might be helpful, Hope, if you can give an update on some of the facilities improvements or even the collection site numbers, just so folks can get a sense of the volume we're seeing.
Sure. So collection site, has really been going up. As of yesterday, I think we were just slightly under 300, so that was a new record for us. And so the team down there is just working incredibly hard and just doing a great job taking care of our community. So really proud of them and really proud of everyone at the hospital. Everyone is working so hard right now. Construction updates, the big thing that's probably impacting the most people is the first floor. And we are in phase 2 of that right now. Initially, we thought that would finish right around Thanksgiving. It's going to be the first week in December, and then we'll move to phase 3. So when we flip from 2 to 3, the coffee bar will go back to its prior location. But the flooring is beautiful, and I know they're getting close. So it's all going good. We've got a few clinic moves going on. But yeah, it's busy.
Is it true that the coffee bar is going to be larger?
It won't be larger yet. We are looking at doing a kitchen remodel over the next year or 2. And with that, we are looking at expanding the coffee bar.
There's a question about PEDS construction or PEDS improvements.
Yeah, PEDS is underway right now, and I believe the final date on that is end of February, 1st of March.
Hey, Allison, you want to tell folks what's happening at the PBX entrance because they might be a little curious.
Yes, so we are working on a pre-screening tool where you go to a nice little website on your phone or when you arrive and you fill out some questions about your potential exposure. So similar to the questions that the screeners are asking right now. And then you stand in front of this very fancy machine and it takes your temperature. And then once you pass both of those things, you will go ahead and get your twist tie for the day and be allowed into the building. So it's a nice way to electronically automate this process so that we can help reduce the amount of screeners that we're going to need. So we're trialing it right now at the PBX entrance, and Lillian and I had the pleasure of going this morning, and it was kind of nice. We had walked across the really cold parking lot. Both of our faces were cold, and the temperature, the screening was still able to capture our temperature pretty accurately, so it was nice.
So if you're curious, you want to check it out, go to the PBX. Hope, what were you going to add?
I was going to say we've only started with a small pilot group right now, so we don't want to have a large influx of people until we're through piloting. We want to be sure that we work out any glitches, but after we do that, then ideally we'll be having it both at the dock and the PBX. So give us a good week to test.
So I did get to do it this morning as well. Once you get the hang of it, it's pretty simple, but it took me a while to do the cycle, but it worked.
Well, if you don't see anyone there when you're going through there, you know, I think you maybe ought to try it out. It is a little bit longer just until we all get the bugs out of it, I think. All right. Anything else to share with the group? Any updates? Okay, well then I'm going to bring our session to an end. I want to thank you all for your continued amazing work. We're going to have some things to know that'll go out this week that has a really lovely emotional message from a son whose dad died here in ICU earlier this week. And the son sent us the message just a few short hours after his father passed. And it made me cry. It made me cry to read it to Monica. It made me, so I just, it's what that reminder of how personal these experiences are that you are creating for our community. You become part of their family, part of their scrapbook. And it's something they talk about all the time. They're going to talk about for years to come. So I want to thank you in the spirit of Thanksgiving. We thank you a lot, but this is a particularly good week to recognize and celebrate what we each are doing to care for each other and care for our community. Please take time to love on your family safely though, so that we can all be back here after the holidays and doing our best work. And I'll see if anyone on the executive team wants to send some love. This is your time. Chris looks like she's hitting the button first.
I just want to say it's an honor to work here, and I really hope that everybody has a really blessed Thanksgiving. And thank you so much for all the hard work you're doing. I really appreciate it.
Dr. Gonzalez?
Chris said it well, and I just want to say I do as well appreciate all of you.
Teresa?
I am really impressed with everybody's level of commitment to the patients and the quality of work that everybody is doing during this very difficult time.
Tom?
He's muted.
I know I'm muted. I was having a problem unmuting, as always. Anyway, again, I am totally blown away by the commitment everybody's had. The ambulatory teams have been just really plugging away and still seeing our patients and doing what's right by them. And, you know, like I think that we're all working really hard at keeping each other safe as well. And that's the biggest message is everybody keep each other safe and be aware of keeping each other safe.
Monica?
I want to thank everyone for all of the teamwork and support that we give each other on a daily basis. I think that this time of we're unprecedented and we don't know what tomorrow's going to bring, that we continue to support one another and share what that looks and feels like with each other so we can continue to take care of our community. Be safe and have a wonderful Thanksgiving.
Javier?
Yeah, I just want to say, being the newest member of the leadership team, how proud I am to be a part of this hospital and to see the work that all of you are doing every day to care for our community. I've had a chance to visit some of our patients, and just continuously they respond with the level of care and compassion and kindness that's brought to them. And I'm just humbled to be a part of all of your team and wanted to say thank you for caring for our community.
Hope?
Yes, I wanted to thank you all for being part of our CSV work family, and thank you all for your hard work and caring for all of our patients every day, and wish you all a happy Thanksgiving.
Kathy?
It is such a privilege to be doing this work, serving our community at this time. You know, who would have ever thought we'd be living through a pandemic? And to be placed in healthcare where we're making such a difference, and to be working with such a profoundly talented, committed team of people, I just could not be prouder and could not be more grateful to all of you for who you are, for what you do, and for bringing your hearts to work every day.
Jennifer?
Yeah, I just want to say I'm very grateful and thankful to work with everyone. This is a great big CSV family, and it's such an honor to be part of it. So thank you all for working so great with everyone. And I think working with me and our team, it's just an honor. So thank you.
Allison?
Well, I feel extremely grateful to be part of this team and this community, not only because we are so resilient and just innovative and creative, and we have been able to do so many things in such a short amount of time, but we are also supportive, and we really are a true family, and we do support each other in everything that we do. And it hasn't been easy, it's been rough, and there's been bumps in the road, but together we have done this and we're doing this, and I couldn't be more pleased and happy to be part of this. We are truly making a difference in our community for ourselves and for our patients. So thank you for everything.
James?
Well, I think everyone has said those things, but I want to remind everyone that we are always available to you if you have any questions, including Thanksgiving and through this weekend, to let everyone know that we are here and available at all times. And we want you to feel that we're there to support all the work that everyone is doing. And please reach out to us if you have any questions.
Yes, please reach out if you need anything at all. You make us all better. You make me better. I couldn't think of a more finer place to be and be sharing my life with all of you. So thank you so much. Have a great Thanksgiving. See you next week. Bye.